Fragile X Syndrome by Chantal Jones and Luciana Pinzon. In this presentation, we're going to cover the different topics of Fragile X Syndrome, like the discovery, the symptoms, the prevalence, diagnosis, prognosis, women in Fragile X, treatments, and local resources.
The discovery of Fragile X syndrome. In 1943, Julia Bell and James Pardon Martin discovered what they described as a form of sex-linked mental retardation that is inherited from the X chromosomes of the mother carrying the trait or from an affected father, which was also X-linked. The syndrome was initially named after the two founding fathers and respectively called Martin-Bell syndrome. The first publication of Fragile X syndrome appeared in a paper written by Martin and Bell titled A Pedigree of Mental Defect Showing Sex Linkage. This paper detailed a family in London's history of a total of 11 males spanning 2 generations who all exhibited similar symptoms of mental retardation. Martin and Bell reported that the conditions were sex-linked, caused select portions of the brain to improperly develop, and hereditary. As a result of the 12 patients all struggling with speech, it was hypothesized that the area of the brain affected was a prefrontal cortex. Symptoms and behaviors associated with Fragile X syndrome are ADHD. It also affects the ability to think, reason, and learn. Social anxiety, shyness, poor eye contact, sensory disorders, and aggression.
So, what are the symptoms of Fragile X syndrome? Fragile X syndrome affects child's intelligence, mental health, physical features, and behavior. Intelligent issues are learning disabilities, low IQ, their IQ scores decreases with age, delayed early developmental milestones. Milestones are social and emotional, communicative, cognitive, as well as physical. Delayed development of nonverbal communication, such as using gestures, body language, and facial expressions. Problems with math and language processing. Mental health problems are anxiety, depression, and obsessive-compulsive behaviors. Behavior issues are attention deficit, hyperactivity disorder, ADHD, social anxiety, and shyness, flapping or biting their hands, poor eye contact, sensory disorders, sensitivity to crowds, touch, sounds, food, and textures, difficulty picking up social cues.
Speech and language is also another aspect that's affected by Fragile X syndrome. Most boys with Fragile X syndrome have some problems with speech and language. They may have trouble speaking clearly, they may stutter, or may leave out parts of the words. They may also have problems understanding other people's social cues, such as the tone of voice or specific types of body language. However, females usually do not have severe problems with speech or language. Typically, children with Fragile X begin talking later than typical developing children. Most will talk eventually, but a few might stay nonverbal throughout the duration of their life.
Physical features are a long, narrow face, a large forehead, a large jaw, soft skin, large ears, and crossed, lazy eyes, very flexible or double-jointed fingers, flat feet, and larger testicles in males after puberty, low muscle tone.
Prevalence of Fragile X syndrome. Fragile X syndrome affects both males and females. Females often have milder symptoms than males. The exact number of people who have FXX is unknown, but a review of research studies estimated that about 1 in 7,000 males and about 1 in 11,000 females have been diagnosed with Fragile X syndrome.
Fragile X syndrome can be diagnosed by testing a person's DNA from a blood test. A doctor or genetic counselor can order the test. Testing also can be done to find changes in the FMR1 gene that can lead to Fragile X disorders. If you're pregnant and concerned that your child has Fragile X syndrome, you can see a genetic counselor where you may undergo the following prenatal test. Some individuals with Fragile X syndrome are able to live independently. Surveys show that around 4 in 10 women and 1 in 10 men with Fragile X syndrome grow up to have high level of independence. The lifespan for people with Fragile X syndrome is not affected because there are usually no life-threatening health concerns associated with the condition. Women more than men have the following abilities: reading books that include new ideas and new words, speaking complex sentences, speaking at a normal speed. Women with Fragile X syndrome thrive more than men. Women, specifically 8 out of 20 women, don't need help with daily activities. Neither do 1 in 20 men. Most women get a high school diploma, but a majority of men don't. Nearly half of the women with Fragile X syndrome have full-time jobs, but only 2 in 10 men.
Treatments. While there's no known cure or a single treatment for Fragile X syndrome, there are treatments that help minimize the symptoms of the condition. Individuals with Fragile X who receive appropriate education, therapy sessions, and medication have the best chance of using all of their individual capabilities and skills. Even those with an intellectual or developmental disability can learn to master many self-help skills. As with many other diagnoses, early intervention is important as a young child's brain is still forming. Early intervention gives children the best start possible and the greatest chance of developing a full range of skills. The sooner a child with Fragile X syndrome gets treatment, the more opportunities there are for learning. ABA is especially effective in individuals with the dual diagnosis with autism.
Fragile X syndrome on the web. The National Fragile X Foundation. The National Fragile X Foundation is active in public policy. They run a National Fragile X conference that attracts thousands of people, that provide resources for treatment and intervention for the Fragile X community. The FRAXA Research Foundation has provided over $21 million to help fund research for treatment and a cure for Fragile X syndrome. The Fragile X Registry, backed by the University of Wisconsin and the University of North Carolina. The Fragile X Registry is a database of people who want to be notified about Fragile X research studies. Books about Fragile X. Dear Megan, Letters on Life, Love, and Fragile X by Mary Beth Busby and Megan Macy. Mary Beth and Megan met when they both became active in the Fragile X Research Foundation. They wrote Dear Megan to offer hope and support to the millions of parents who care for and love their children with disabilities. Understanding Fragile X Syndrome, A Guide for Families and Professionals by Isabel Fernandez Carvajal and David Aldrich. This handbook offers a straightforward introduction that clearly explains the conditions on both scientific and practical level. Fragile X, Fragile Hope, Finding Joy in Parenting a Child with Special Needs. Elizabeth Griffin's son Zach has Fragile X syndrome, the most common known cause of inherited mental impairment, and is among the 20% of people with Fragile X who have autism. Whether you're a parent of a child with special needs or you struggle with unresolved grief, chronic stress, or depression, Fragile X, Fragile Hope shows without a doubt that you can survive, and more than survive, you can find your way back to a joy-fulfilled life.